Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today's topic will be a really basic one. It's basically 101 of laser hair removal. So we're starting from basics and I'll tell you all you need to know and more in regards to laser hair removal. So the first thing is that if your hair is white, it is not suitable for laser hair removal. The reason being is that we need a chromophore or a target to hit. So laser hair removal only works if you have dark hair. Okay, fact number two, a laser is different from IPL. Now the industry in Australia and I guess in the US and many countries, and they're not regulated because beauty salons are doing things and medical specialists are doing things. So it's out there and everyone does things. So if you see something called this, which is an IPL, don't go near it because this is not gold standard treatment. Yes, did we used to do this for laser hair or hair removal? Yes, we did this, but this is a decade old technology. Does it work? Yes, it does. But with the newer systems, IPL is far outdated. So if anyone's trying to convince you to do IPL for hair removal, walk away because there are much more effective systems. Now with laser hair removal, there are basically three things that we want to consider. The wavelength of the laser, because that will determine the skin type and the safety of the laser itself. So the wavelength of the laser, the inbuilt cooling system of the laser, so that will determine both comfort levels and also patient safety. And also your skin type, what color you are. For example, for me, I would suit a particular laser compared to someone who's fairer or someone who's darker. Okay, so we can go through those systems very shortly.
In order for the follicle to be optimally damaged, the bulb, bulge, and vascular supply should be present. It is in the anagen phase of the hair growth cycle that the follicle can be optimally targeted. The growth cycle varies depending on which part of the body the hair follicle is found. This is why hair removal requires successive treatments at various treatments.
Okay, now we can talk about cooling systems. Now the cooling system is really important for two things. Number one, patient comfort, and number two, protection of the upper part of the skin or your epidermis. So remember, we do not want to blister the patient. We do not want to treat the upper part of the skin. We want to preserve that, but we want to actually deliver all our energy to where the hair bulb is. So there are different cooling systems. If we look back to our old-fashioned, oops, nearly tripped over there, old-fashioned systems like our IPL, the cooling system uses a sapphire crystal. So this sapphire crystal we still use in the modern cooling systems. So it still pertains to lasers. Another way of cooling system or basically to decrease pain is to use what's known as a gated theory. And a gated theory is basically suction of the skin. And Luminis makes a really good laser called the Light Shear. That's probably my favorite laser, it's an 810 diode. And it works by actually sucking the skin. And realistically, this treatment is painless. So watch me having this laser done. Rach, you do it. Okay, so we're doing hair removal now. Okay, so what do I feel then? Really, it's probably 1 out of 10. Let's keep going all the way down my leg. I've got burnt hair everywhere. I should be shaved, so, but that's fine. Even with burnt hair, like seriously, the pain I can actually talk through. It's really 1 out of 10. Okay, let's stop it there. So ideally I should have shaved my leg. replicate it, but I didn't do that for the purpose of this video. But look, this is this machine here. I think is the future. 810 diode, and for my skin type, especially for my leg, when we're using large spot areas, it's very quick. So what you want is you want a reliable, effective, painless, but also super quick procedure, and this is it. Hey, come here and I'll show you another thing. This is a treatment which I had. Have a look at this, guys. So that is a treatment which I had with just one treatment of this 810 diode 2 months ago. You can see it's almost hairless compared to, yeah, I've got dry skin, that's pretty bad, hey. But anyway, compared to the other leg. So you can see how good this machine is. That's just with one treatment 8 weeks ago. Okay, and the third thing we can do for pain relief as well as cooling is to actually use what's known as a Zimmer. A Zimmer machine basically blows cold air and decreases pain that way. Hey guys, so this is what we call a Zimmer cooler. It's a big machine. It's basically like a refrigerator with an air conditioner, and this basically blows cold air, and that alleviates the pain when you're actually having hair removal. It doesn't really protect the skin, unlike what a cryogen treatment can, but it actually helps with the pain. So it's just cold air, and it's distracting to the patient. So this is another way of actually decreasing pain from hair removal. Not as good as cryogen, but like I said, it's better than nothing. I've got a tech over here from Syneron Candela who's going to explain to us in 10 seconds what a cryogen canister is and what it looks like. So we've actually got a machine opened up here just as we're servicing it. So let's go. What are we looking at here, mate?
There you go, that's the cryogen canister there.
Yep.
And in this box here there's a heater.
Yep.
That heats the canister up until we get 118 psi.
Yeah.
And then there's a hose actually goes up through to the front panel here.
Yep.
And there's a little valve in the front of the handpiece here.
Wow.
Which releases the cryogen.
Super good. How's that by fluke? We're getting a laser service now, and look, cryogen, I guess with the cooling system, do you agree is probably the best way of pain relief and protecting the skin?
It's more accurate.
I reckon it's more accurate than gel. I hate working with gel. Gel's really messy.
And the Zimmer coolers,
yeah,
are okay.
Yeah.
You have complete control over the dose with the cryogen, in my opinion.
Yeah.
I'm a technician.
Absolutely. Look, I'm a clinician. He's a technician. We both agree that cryogen is probably the better system for cooling.
Yeah.
And I think from a safety point of view as well, especially when we're using these for port wine stains and all.
Yeah, exactly. Yeah. And for vascular work.
Yeah,
there's
absolutely.
There's no comparison.
Okay, let's talk about some myths about laser hair removal and myth bust a few things. First of all, is it permanent? Yes, it's permanent reduction, but it's not a permanent treatment. Most people will need top-ups at some stage of their life. And the ones that need top-ups are usually the ones that are hormonally driven. So 10 to 20% of females will suffer something called PCOS, or polycystic ovarian syndrome. This is a hormonally driven process by which you get excessive hair known as hirsutism. So for these people, laser hair removal does not work as well when it comes to permanency. So they will need 2 to 3 top-ups, possibly 2 to 3 top-ups a year, maybe 1 to 2 top-ups after that. Okay, so that's the first thing. The second thing is that for men, especially because we've got lots more testosterone, our hair tends to be thicker, and especially with our back hair, you will need more treatments, sometimes up to 10 treatments. And because it's testosterone driven, sometimes it tends to recur much quicker than hair in females, for example. Oh, another myth about hair removal is how often you need to get it done. It's not a 1 or 2 treatment process, it's multiple treatments. How many treatments depends on your genetics. So for example, Asian patients like myself, we're kind of hairless compared to, let's say, without being prejudiced, to Greeks, for example, who've got more hair. So it depends on genetics, it depends on race, it depends on individual factors as well. And most patients will need at least 5 to 10 treatments depending on the area and depending on the hair type and ethnic background. So there are many variables, and someone who's good at doing hair removal would know approximately how many treatments you will require. Okay, so how do we prepare ourselves for laser hair removal? The first thing is very important. The first thing you want to do is avoid sun exposure. So avoid sun exposure for at least 2 weeks before laser hair removal. That also includes using fake tans, because what we want to do is we want to hit the chromophore, basically it's the target, which is the melanin within your hair follicle itself. So if you're tanned, it makes it, most of the laser energy gets taken up by your skin. So it makes it less efficient and more unsafe. There's a high chance of blistering. So that's the first thing. Avoid tanning for at least 2 weeks before. The second thing is avoid plucking your hair. Avoid plucking your hair, avoid waxing your hair for at least 2 to 3 weeks prior, because remember, we want that actual hair bulb there. So if you pluck that, there's no target to hit. Okay, number 3, make sure you shave. The reason why you want to shave the night before is because we don't want the laser itself to hit the hair on the outside. We basically want the laser to target the hair bulb, which is underneath your skin. So if you shave the night before, you're going to be much more efficient when it comes to laser energy. The fourth thing as well is sun protection afterwards. Super important to remember to actually look after your skin. If you do go out after laser, you may get post-inflammatory hyperpigmentation or skin darkening, so stay safe with that. Hey guys, look, thanks so much for watching this video. It's a really basic video on laser hair removal, and it's a procedure which everyone is doing, but I guess no one is really making good videos on how to actually look after your skin or the truth about hair removal.